Archive is an international, non-profit organisation using architecture through improved housing design to improve health among the world's poor. Globally, among the poorest people on the planet, 6 out of 10 people die from infectious disease every single year. At the same time, currently 1 in every 4 people living in developing countries lives in a slum. For far too long, these two challenges have been addressed separately. Archive launched Sante nan Ayiti in 2010 to draw attention for the need to improve housing and health in Haiti simultaneously. Archive is building 5 housing units in St. Marc, Haiti, a coastal town approximately 100 kilometers north of the Haitian capital Port-au-Prince. What makes our project truly unique is that throughout the entire process, from design, construction through to habitation, health, particularly by seeking to minimize disease transmission, has remained a key ingredient. FEBS, Foundation Establishiko Stanislas, is Archive's client for the Sante nan Ayiti Open Innovation Competition. FEBS itself is an organisation in St. Marc, Haiti, established in 1996 to fight the spread of HIV and to provide support for those living with the virus. FEBS members like to think that the EBS in its name stands for Ensemble Bravons le Sida, meaning Together We Fight AIDS. FEBS has an immense presence in the community and currently provides psychosocial, nutritional and medical support for 500 people living with HIV/AIDS. Through community sensitization via radio and television appearances, in addition to community workshops with schools and faith-based institutions, FEBS has significantly diminished stigma against people living with HIV/AIDS and has made it possible for this population to live socially integrated and healthy lives. With free health and nutritional support already being provided to their clients, housing remains by far FEBS's greatest unmet need. FEBS also aspires to develop additional support services on the premises of the site, including such facilities as an orphanage. Their driving goal is to assist all people living with HIV/AIDS in St. Marc to find their own Tiquen Paradis, or little piece of heaven. At the house of one FEBS client, we saw no windows present. This greatly inhibits ventilation and contributes to the extreme heat inside. It's sometimes the case that cooking takes place indoors. The tin roof, which barely provided cover, did little to prevent rain from entering the home. The result of all this? Excess moisture has encouraged mold growth on the walls, providing an ideal environment for increasing the environmental risk of transmitting respiratory diseases such as tuberculosis, a disease for which Haiti unfortunately has the highest rates in the entire region. In addition, the walls were constructed using a shoddy method which consisted of covering wooden framework with a concrete mixture. They are now beginning to deteriorate and crumble. This type of construction would likely not survive an earthquake. However, good housing does not require a high-tech solution, but a thoughtful design approach utilizing simple yet effective strategies. The 5 winning designs showcase many innovative ideas for minimizing disease transmission while improving living conditions of the local population. The designs are also sensitive to the economic and cultural environment in which the homes will be built, being replicable and inexpensive, utilizing local building materials, and employing indigenous construction techniques and practices wherever possible. Archive will initially build 5 prototype units from the Sante nan Ayiti competition-winning designs. It is planned to build these units over the next few months, and if resources are secured, build an additional 20 units based on knowledge gained from the initial building process in time. Having set a deadline for competition entries of September 2010, Archive received approximately 150 entries from several countries. Archive very strongly encouraged multidisciplinary, cross-cultural and international collaboration, as the competition had the potential to ignite further conversations about the relationship between housing and health, particularly with an aim for examining the extent to which housing improvement could reduce risks associated with tuberculosis transmission. The entries were then examined by leading professionals around the world, drawn from a wide range of sectors, including public health, medicine, built environment, and international development. Esther Boucicault, the founder of FEBS, was also on the jury. The judges especially sought entries that considered a range of factors, including ease and cost of construction, ventilation strategies, environmental sustainability, novel sanitation systems, and cultural adaptability. From the entries reviewed, 5 were selected for construction. The following images show the development of the houses from concept to our current stage of construction.